Okay, this is my infection control video. This is my infection control gear. The first thing I'm going to do is my pre-procedure steps. I'm going to check my orders. I see that I need to wear PPE. I'm going to gather all my supplies. I'm going to put all of this on before I go into the patient's room, but after that I will introduce myself to the patient. I will check their ID and I will ask them to verify their name and date of birth. I will provide privacy, explain what I'm going to do, and then raise the bed. So the first thing that I will put on my PPE is my gown. Just put it on like this. Make sure that it's up. And then I'm going to tie it in the back. I'm already wearing a mask because of COVID, but at this point I would go ahead and put on a mask, pulling it by these strings, and then I would put it on, loop it around my ears, making sure that it goes under my chin, over my nose, and then I'm going to pinch the bridge of the nose to make it tight against my nose. The next thing that would go on is my goggles. I'm going to put those on. And then the last thing that I would put on is my gloves. I'm going to put these on, and I'm going to make sure that the end of my glove goes over the cuff of my gown so that I'm fully protected. And I will put on my other glove. Okay, and then I've got all of my PPE on. When I'm done with my patient care, before I leave the patient's room, I will step away and I will take off my glove, holding the outside like this, ball it up in one hand, and then I'm going to take one finger, stick it inside this glove, turning it inside out, take off my other, and that will go in the trash. Next, I will take off my goggles, so I'm going to take those out, holding them by the edges, and setting them there. Don't touch them by the front because they could have gotten some sort of splatter on them. Next, I'm going to take off my mask and I'm going to just loop around here by the lobe of my ears, grabbing the strings, taking it off like this, and then that would go in the trash. But I'm going to put it back on because of COVID. And the last thing to go off is my gown, and I'm going to untie it in the back. I'm going to take my fingers on the inside of the gown, turning it inside out, and then I'm going to ball this up, and this will go in the trash. After that, I will exit the patient's room and I will wash my hands.